morning, everyone. I'm Marla with 9 Health, and I'm joined today by Monica Caballeros from Connect for Health Colorado. Thanks for joining us.
Thank you for having me here.
Yeah, we're in the park.
We're in the park.
Why are we in the park? We're going to learn about that. We are going to talk a little bit about insurance, but you'll be surprised what you might learn today and what we might be telling you. So stay tuned. If you missed us last week, go ahead and check us out on Facebook. We have videos there and on 9healthfair.org. So we're bringing information today to help you make informed decisions about your health. And one of the big things is insurance.
That's right.
We may not like to talk about it, but it's so important. And if we're out in the park, that's why we're here. If you're snowboarding, if you're playing tennis, or just enjoying time in the park,
That's right.
you need insurance. Why is that?
So insurance is important because it helps you pay for the health care that you have, and it helps you pay to get, really to help you pay your medical bills too. And so if you don't have insurance, for example, and you have a hospital stay for 3 days, that could be as much as $30,000.
$30,000.
That's a lot of money.
Who can afford that?
And one of the biggest reasons that we still see for people going bankrupt is because of medical bills. And so whether you're out in the park, you're enjoying yourself, you don't want to risk having an accident. You know, maybe you're running, maybe you're playing a sport and you break your arm. Things happen. And so that's why it's so important to have health insurance.
What happens if I break my arm? What's the average cost of like a broken arm?
The average cost of a broken arm is $7,000 without health insurance.
That is a lot.
It's a lot of
Who
money.
can afford to pay that?
Not many people.
Okay, but that's why we're here. November
Yes.
is open enrollment month for health plans.
That's right.
Tell us what that means, really.
So the open enrollment period is a window of time in which Coloradans, even if they already have health insurance, that they can change their plan or they can renew their coverage. And so it started on November 1, and so we are well into open enrollment right now. And it's actually going to end on the 15th of January. So we have a nice 2.5-month window where you can shop around, compare your plans, and really make sure you're getting the best deal for the year 2020.
That's great. And so it just started, so there's plenty of time.
Yes.
But don't wait till the last minute. Why not?
So you don't want to wait till the last minute because outside of the open enrollment period, once it's closed, you cannot change your plan or buy a new plan unless you have what's called a life change event. And so another really important deadline that I want to highlight is the 15th of December. And so the 15th of December is the last day that you can sign up to get coverage that starts on January 1 of 2020. So even though you have until the 15th of January, get in before December 15 so your coverage will start the 1st of the new year.
Okay, great. So before we get any further, we're in the park. We're having a lot of fun. We're talking to Monica Caballeros from Connect for Health. And we're talking about insurance and why it's important. Now is an important time because you can actually shop and get a plan. But what if we don't know how to do that? That's so confusing. Tell us a little about what is Connect for Health Colorado and what kind of things you can help us with.
That's a great question. So for those who are watching, Connect for Health Colorado is the official health insurance marketplace of Colorado. That is a fancy way of saying that we are the nonprofit organization for the state that sells plans that are that have the essential protections and benefits as part of the Affordable Care Act.
That's important. You guys are a nonprofit.
We are a nonprofit organization.
And you are funded by the state to be able to help people, state and federal.
Correct. And then we also, from the funds from health insurance companies as well.
Right.
But really we're here to make sure that people understand that if they don't qualify for Medicaid coverage or Medicare coverage, TRICARE, or if you can't get insurance from your employer because maybe you work part-time or you're working for a small business who doesn't offer it to you, those are all kind of scenarios that you might find yourself looking for a health insurance plan through the marketplace Connect for Health Colorado.
Yeah, so insurance might be more accessible or affordable than you think.
That's right. And you bring up a good point about affordability. So since we're the official health insurance marketplace, we're the only place where people can apply for tax credits to lower their cost of health
That's
insurance.
important,
So
yeah.
only place you can go to get financial help.
Okay, and so if I was thinking about getting insurance and I thought maybe I needed some financial help, how do I know if I qualify?
So in the year 2020, an individual can make up to about $50,000 and a family of 4 can make up to $103,000 and qualify for financial help.
So that's more than I would have thought.
It's a bit more. And, you know, let's say you're thinking, okay, it sounds great, but I'm still really not sure about my own situation. We have expert help all across the state, and so you can get on the phone with somebody. You can go visit an enrollment center. We have enrollment centers all around, and really kind of ask someone, these are my income sources. This is the amount of people in my household. So you can really understand your specific scenario.
Yeah, because it's a little confusing. We were talking about this earlier. So if you're just joining us, we're here in Wash Park, beautiful Wash Park. And, a week ago it was freezing cold. We wouldn't have been standing here. But today we're out here in no jackets, no coats. It's beautiful. And that's Colorado. We love to be outside. And if you love to be outside and love to be active, insurance is going to play an important part for your health. But why we're here talking to Monica Caballeros from Connect for Health is we want to make it understandable for you. So if you have questions, what are your questions? You don't know if you qualify for tax credits. You don't know what a copay is. There's no shame in that because a lot of us don't know, right? You were telling me a story earlier. Share that story, yeah.
I used to work in an enrollment center. I used to help people get enrolled into these plans, and I would really often see people who would come in, they'd be clutching their tax forms, and they'd be whispering to me, I run my own business, I'm really smart, I really get these other complicated things. I'm really stuck with my health insurance. I don't understand what questions I even need to start asking. And so, if you're in that situation, you're not alone. Health insurance is really complicated, and that's why we've worked so hard to make sure we have enrollment centers across the state.
Yeah.
You can go on the website, you can give us a call. There's lots of ways that you can get help if you are feeling just totally lost and don't even know where to start.
Yeah, we'll put that website in our feed when we're done here because there's a lot of assistance. If you just have a question, you can answer it.
Yeah, we actually have a question from Matthew. He says, I already like my plan. Do I have to shop?
Good question. So why should I shop this year?
That is a great question. So even if you're happy with your plan, plans and prices and insurance companies that are available in your community change every year. And so even if you're thinking, I really like my plan, it takes only a few minutes to go on our website, give someone a call, go to an enrollment center, and see if maybe there's something that has those comparable benefits, but maybe the premium is a little bit lower, or maybe it has a different type of deductible, or the deductible works a different way. There's just so many factors that go into what makes an insurance plan fit for you. And so, just taking those few minutes to just double check your options, see if there's anything new, to see if there's something that's going to save you monthly, save you on your out-of-pocket costs. It could save you in the long run.
You're saying a lot of words that we may not know. So you say out-of-pocket costs.
Yes.
You say, what does that really mean to us?
That's a great question. So there's a couple insurance terms that are really key to understand.
Okay.
I think the first one would be your premium. And so that's the monthly payment that you make so you can have access to your health insurance. So a lot like your car insurance, you pay it every month even if you don't use it. But those out-of-pocket costs that you mentioned are going to be a copay. And so that's the amount that you're going to pay when you go to get services from the provider. So it could be $20, it could be $40, it could be $5.
Okay, and that depends on the plan.
And it
so
depends
it's why
on
you
the
want
plan.
to shop.
Exactly.
Now, I've heard that premiums are going down this year that for most plans. How is that going to affect most of us, and what should we know about that?
That is a great point. Premiums are going down across the state this year. And
so is that good news? That sounds like good news.
It's good news. Yeah. But even with the premiums and the monthly plan prices going down, we still want to make sure that people know it's so important to shop because, as I mentioned, insurance companies might change in your area, and you may just find that there are different plans that are going to work better for you depending on maybe what's changed in your own household situation. So, maybe you have been diagnosed with a chronic condition in the past year, and that means that you might need something that has a little bit more coverage, or maybe you need to pull back a little bit. You didn't use your coverage that much last year.
Talk a little bit about that.
Sure.
So I was just diagnosed with a chronic condition this year.
Sure.
How does that change my insurance needs? Like what changes for me?
So if you're, for example, diagnosed with a chronic condition, one thing you might want to consider is looking at plans that are a little more expensive on the monthly payment side of things, the premiums. But when you actually go to use services, the amount that you end up paying is going to be less because
your copays and deductibles
your copays
might
and
be
deductibles.
less. Okay.
Exactly. So it's one of those things where you, and for this reason, maybe you want to call an insurance broker or you want to go to an enrollment center so they can really talk you through and understand, maybe if you do have some more medical needs, even though the monthly sticker price is a little bit higher, it's actually going to save you in the long run, because when you try to, you're going to pick up a prescription, you're going to go to see a specialist who maybe you didn't see last year.
Yeah.
You're going to actually save in the long run by paying a little more monthly.
Now, if your eyes are glazing over and you're thinking, oh my gosh, I can't comprehend all of this, there are places where you can talk one-on-one, you can get assistance. Tell us about those.
So we have partnered with hundreds of certified brokers, community-based assisters, and enrollment centers, so that people can get help no matter where they live in the state and no matter how they prefer to enroll. So I know not everybody loves to go online, and again, it's really complicated. And so if you're not really insurance savvy, and you just definitely don't want to do it online, you want to talk to a real human being, we made that available.
Great. And so you can go to an enrollment center, and we will have all that information in the feed. The other place you can go is we at 9 Health Fairs support Connect for Health Colorado, and we have an enrollment people at our health fairs this weekend and the coming weekends. So you can go to a 9 Health Fair, which are all coming up, and it's one great way to really help yourself save some money on your health costs, right? Because you get those screenings and stay on top of your health. Hopefully you can avoid some of those major expenses when you have a chronic disease or emergency. So that's my plug for 9 Health, because we do partner with you guys, and it's a great partnership.
It really is. And as you mentioned, preventive care is really so important. And going to a 9 Health Fair, getting yourself checked out, making sure that you're healthy, that's really key.
Yeah. Well, here we are in the park today on this beautiful November day, and we're talking about health insurance with Monica Caballeros. We're gonna take off here and go play tennis. I don't think we can snowboard today, but maybe later this month. And if you have still questions for us, or you need more information about health insurance, even if you're not qualifying for a tax credit, you can go to Connect for Health Colorado and find some information. And if you're looking for a health fair, 9healthfair.org, find a fair and get out there and get to a fair. It should be nice this weekend.